Hello, everyone. Welcome back to another episode of ScrubbedIn USMLE series. And we have come here with a very important topic of discussion, and that is giving your USMLE Step 1 during the final year of MBBS. So let's start without a delay. All right. So you've just entered your final year of MBBS, and you're seeing around that a lot of people, they've already given their USMLE Step 1 during their fourth year, and there are even some people who have given their exam in third year. So you're wondering, am I too late? A simple answer is no. And what I'm going to tell you now, it is very important that you understand it completely. You cannot compare yourself with someone who has given their exam during their third year or fourth year of MBBS. And the reason is that you and the person who's already given their exam are going to appear in the same math cycle. So it's not like they've gone ahead of time or you have lost any sort of time. And at the same time, you must make sure that you are not waiting for your MBBS to end before you give your USMLE Step 1. The reason for that is after your MBBS, after your final professional exam, which is around which is around the start of April for most universities in Pakistan, especially the ones that are associated with University of Health Sciences, Lahore in Pakistan. You have around 6 to 7 months, and you are supposed to do your USMLE Step 2, your US clinical electives, you have to give your OET exam, and there's a lot of paperwork to do. And probably you are thinking about doing some sort of research as well. So in that little time, you cannot think that you're going to add Step 1 there as well. So it's imperative that you do your Step 1 exam during your final year of MBBS. And trust me, if you watch this video, we are going to guide you completely how you're supposed to do that. And in the next segment, we are going to tell you how are you supposed to prepare in a short time. And obviously, it includes using the right resources and using them efficiently. And now Armeen is going to explain it to you how you're supposed to do that. So over to you, Armeen.
Okay, so the second most asked question is, how do I prepare in a very short amount of time, which is of course understandable because final year is not very long. You don't have that much time. So I'm going to tell you what resources are right for you and how you should be using those efficiently. Okay, we're going to start with a mnemonic. It is UFAPS, and some of you may have heard of this, some of you may not know of this. These are the resources that are recommended, well, we recommend and others do as well for the Step 1 preparation. So UFAP stands for, first of all, UWorld. This is first aid. Then we have Pathoma. And then we have Sketchy. Please excuse my handwriting. Okay, I'm going to address UWorld in just a second, right at the end, because this is the most important one. Let's start by addressing the other three first. So first aid, specifically for us, for when we were doing our prep, first aid was not a primary tool. Okay, so it was not a learning resource. It was not something we used to clear concepts. It was not up there in the top 5 resources. So with first aid, what you can do is, yes, they have some great tables. For example, in the biochemistry section, you have great glycogen storage disease tables or your lysosomal storage disease tables. They're a great revision tool, but they're not a learning tool. So if you're using first aid as a learning tool, you're not really going to be understanding anything. And that's both of our point of view. And we found that quite early on. So we did leave first aid as a secondary source, and we were using it
as well.
It does. It takes a lot of time to go through the whole of first aid, and you don't have enough time in final year to do it front to back, reading every single thing. So please keep that as a secondary tool, which you can use to revise rather than study for the first time. Okay, so that's first aid done. Then we're moving on to Pathoma. So Pathoma, hopefully everyone who's got to final year has used Pathoma at some stage, because this is key. This is my top resource. For me personally, this is the one that's right up there. For pathology, you need to be using Pathoma. And for someone who's thinking of doing Step 1 in final year and they have never used Pathoma, that's what I would recommend they do as the first thing. So start off by doing Pathoma, watch the videos. You must use Pathoma with videos. You cannot be using Pathoma on its own. You won't understand anything. And also Dr. Sattar, during his lectures, he does these drawings and he gives you a lot of extra information, which is not included in the book. You need that for your understanding. Pathoma is key. I cannot emphasize that enough. You must know.
I would just like to add, if like someone's really anxious and they really want to start UWorld straight away. So what they can do is that they can try starting UWorld, and if they're comfortable with that and they haven't done their Pathoma, then that's fine. They can continue with that, right?
Yes. So if you are confident with your pathology, again, from your third and fourth year, then of course you can go away with UWorld. But to be honest, I would still recommend Pathoma a lot because I think it's very, very important. There are things that just come up right at the end that you need to be aware of.
I
But
agree.
yes,
I agree. Yeah.
you can give that a go. Okay, the next thing is Sketchy. So Sketchy, what am I referring to for Sketchy? I'm referring to Sketchy Micro, to Sketchy, and to for Sketchy Farm. Now Sketchy Micro and Farm, these are both essential. So Sketchy Microbiology, you won't be able to learn all of the organisms by heart from books such as, I think it's Levinson. They're way too complex. You must know Sketchy Microbiology. It's essential. And for Sketchy Pharmacology, this is a controversial topic, so some people don't agree with this. Personally, we did use Sketchy Pharmacology to do all of the pharmacology lectures, most of them actually, and it was a great resource. So because there are so many drugs to memorize and there's so many mechanisms of actions to memorize, you need something that will help jog your memory. So those pictures for Sketchy, even if you look at them right at the end during the last month, it's a great revision tool and it's very easy to understand. So I would recommend Sketchy Pharmacology. But again, if you are confident with your pharmacology in final year, you think you have a good grip on the topics that you've done in third and fourth year, by all means, you can skip over pharmacology because I know you are scarce of time with time.
I mean,
Okay.
there's a question that people often ask about Sketchy. They're like, there are so many pictures. Don't they all get jumbled up and don't you mix all of them?
Yeah.
What would you like to say about
Yeah.
that?
Okay, so to be honest, think about this. We've done Sketchy Microbiology, we did Sketchy Pharmacology. I don't even know how many pictures that is, honest. There's so many. Yes, that's true. But even till this day, I do not get them mixed up because I've gone over them so many times when I'm revising them. Even when you're sitting down, you're just having breakfast or something, we would open up the picture book or we would get the image online or on Google on our phones, and we would just look at it and we would revise without any text, without the video. So if it's spaced repetition, you have to use spaced repetition during your studying phase because that's what consolidates your knowledge, and you will not forget the images. They will not become jumbled up. That's a guarantee for sure.
I agree, yeah.
Okay, that's all of the resources done. Now what we're going to do is I need to talk about UWorld because this is the most important thing. Okay, so I'm just going to rub this out and start again. Okay, so UWorld is the most important resource that you are going to be using, and this is what you need for your practice. Now I'm going to tell you a few things that you need to keep in mind. Please understand these. Random timed mode. Okay, random time mode. You need to understand what this means. When you're doing UWorld, especially during your final year where you do not have time to do a second pass of UWorld, you are hardly going to get time to do the first pass. You need to be attempting questions in random timed mode. That means all of the different systems will come up and you're timing yourself with your blocks. Okay, so that's the first thing that you need to remember. This is very, very important. Do not do UWorld system-wise, do not do UWorld on time, do not do it on tutor mode, do it in random timed mode. Okay,
Since you've
second thing
already
is
passed fourth year, it doesn't make sense that you revisit the systems, right?
sorry.
Since you've already done your fourth year, it doesn't make sense that you revisit all the systems individually.
Yes, so because you've already done your fourth year, you do not need to go through those individual systems again. That's just wasting time and you don't have time. Okay, so with UWorld, you have around 3,800 questions. This translates to around 95 blocks. Okay, 95 blocks means if you're doing one block per day, that's 95 days. And let's say you're giving yourself some free days. So I'm going to recommend that you do UWorld in around 120 days. Okay, so that is approximately 3 to 4 months. Okay, give yourself 3 to 4 months for UWorld, 120 days to do all 3,800 questions. Now, how do you do UWorld? You do one block per day, 40 questions in random timed mode. Then you review those 40 questions that same day with explanations. You revisit the concepts that you haven't understood, you revisit them. You go back to your textbooks, you go back to Pathoma, you go back to first aid if that's your revision tool, you go back to whatever you're using, and you have to make sure you are understanding that question that you got wrong so you do not get it wrong again. Okay, so you have to be very strict with yourself. You have to discipline yourself. UWorld is so essential. I can't stress this enough. This is what's going to get you past that pass mark and get you into the safe zone, essentially. And to be honest, another thing that I was discussing today, our real exam it was most similar to the UWorld questions. It was not very similar to NBMEs. It was not similar to Theory 120. It was not similar to any AMBOSS assessment. It was similar to UWorld. And if we hadn't paid that much attention to UWorld, we would not have done as well as we did. So please keep this in mind. That's everything about UWorld. I've got one more resource left to discuss. Let me just clear this screen. And the last resource that I need to...
So let me just add it. We plan to make a video totally on UWorld because people fail to understand how important it is as a resource for USMLE Step 1. We will make a detailed video on how you're supposed to do UWorld and how you're supposed to use it as a learning resource and not as a resource where you test yourself and where you score yourself.
Yes, that's really important as well. We will do that for sure. And the last resource that I need to discuss is boards and beyond. Okay, so there are, I think, around 2 things that you need to cover from boards and beyond. The first thing being biochemistry. We have a lot of questions on where to cover biochemistry from, especially if you're in final year, because you probably have forgotten biochemistry. You do that from boards and beyond. And please be aware that do not get overwhelmed by biochemistry because you will not know until the last day. You'll still be revising it right at the end. All you need to do for biochemistry is you need to focus on the metabolisms. You'll be revising this right until the end. And Boards and Beyond is a good resource to use if you haven't visited biochemistry in the past 2-3 years. So do that for final year, go through that, use that for your biochemistry. And the second thing that you need... I would
just like to add, there's lengthy videos of Boards and Beyonds on different vitamins. So you don't need to do those because when you're doing UWorld, it's already telling you what sort of questions you can expect in your real exam regarding vitamins. And it's quite easy to understand when you're doing UWorld. So you don't need to visit vitamins when you're doing biochemistry and Boards and Beyond.
Okay, and actually one more thing that I need to add here is that with biochemistry, you have to also use Boards and Beyond for genetics as well. So genetics, the whole of that should be covered from Boards and Beyond. I'm just going to write that here. Genetics and biochemistry, you do that from Boards and Beyond. And the second topic that you need to use Boards and Beyond for is psychiatry. So for psychiatry, the videos for Boards and Beyond are very extensive. They're very good. They're in detail. That's all you need to cover this topic from. It will be, you can use your first aid to revise psychiatry from the tables because it's written quite well in there. But yes, these are the only 2 things that you need to cover from Boards and Beyond. And that concludes the right resources section. Please be aware that we will be discussing all of these resources in detail, especially UWorld, because we will go through how to attempt the questions and how you should be reading the question. So all of that will be in due time. Okay, and there's one more thing that I need to add here, and that is regarding the ethics question. Now, in the past few years, there has been a more increased focus on your ethics questions in your actual exams. Our exam was actually very heavily based on ethics. So these can be covered from, first of all, UWorld, your practice questions. They will direct you in what way you need to study for the ethics questions. Also, if you are able to get the AMBOSS subscription, there's a 5-day free trial, I think, that you're able to get. Please use that as well. You can use the AMBOSS questions for your ethics component. And also, Dirty Medicine is a YouTube channel which does very good explanations of how to address your ethics questions. So these 3 sources are good for tackling this system. And please be aware that, yes, now the upcoming exams, they're more ethics based. So make sure that you are comfortable with this topic.
Okay, so now the resource that it was the hack for ethics for me, like near the exam.
It was, yes. Okay, so let's move on to the next section, which is when is the right time to appear for your exam?
Okay, so let me tell you that. So there are certain indicators that indicate when you're supposed to appear in your exam and when you're ready. And obviously there are some long self-assessments that mimic the actual exam. And we did 10 self-assessments. 6 of them were NBMEs, which were NBMEs Form 25 to Form 30. And then we did 2 UWSs, which is a short form for UWorld self-assessment. If you're buying a 6-month or a 12-month subscription, and they come free with them. And the last one was free 120s. We did 2 free 120s, an old one and a new one. And we've highlighted this in that box over here as well, that your scores never lie. So if you are getting a good score in these self-assessments, you have to trust the scores, and you need to know that if you're getting more than around 70% in your NBMEs especially, you're in a comfortable position. And if you're consistently getting those scores, I think you should just go for it and you're going to ace the exam. And you have to remember that this exam isn't scored anymore. All you need to do is get more than 196. And that is really easy. I must say that it was really easy. And even when you do UWSA2, it gives you a predicted score, and that's going to make you realize how easy it is. So in the end, I would like to conclude, if you are trying to appear in your step 1 exam during your final year of MBBS, no, you are not too late. Do not delay until you're done with your MBBS, because that is very important. It's going to leave you with a very little time to do a lot of things after your MBBS. So that's going to make you panic, and that may make things very hectic for you. So if there's anything else, Armeen, you'd like to add some motivation maybe?
Okay, so everything that we've discussed, I don't want anyone to feel too overwhelmed by this. Everything, the resources, for example, we will be discussing in detail. So don't worry about that. If you have any questions, please do let us know. I know final year can be a very stressful time. You've got clinical rotations, you've got new subjects, but remember, it's not impossible. And this exam, it is more about exam technique rather than how much you know. Keep your confidence on that exam day. Make sure that you're utilizing your time well. Your last month is very, very important, and we will have strategies for last month preparation further down the line. And all I can say is good luck. If we
You just, like I said earlier, you just need to know that you've already done your 4th year of MBBS. So that means you've essentially done all the syllabus of USMLE Step 1 during your MBBS as well. So it shouldn't be, if not equally difficult, it shouldn't be more difficult for you. So stay calm, you've got this, and it's just a matter of around 4 to 5 months and you're going to ace the exam.
Okay, so that's everything from us for today. Again, if anyone has any questions, please do let us know, and we will see you guys next time. Bye-bye.
Bye-bye.